His claim is so great, the accusations are so terrible. Where is Elon Musk running with Neuralink? When Elon Musk's companies are mentioned, Tesla and SpaceX usually come to mind, but there is also Neuralink, which has been operating without much attention since 2017. While the job posting recently opened by Neuralink, which is trying to develop a device that will allow us to control machines with brain power, has caused mixed anxiety, the accusations brought up by an animal rights organization are on the way to turn into a scandal that will give Musk a headache. Here are all the details. Elon Musk's company Neuralink, which conducts research to establish an interface between machines and living brains, that is, to manage machines directly with brain power, published an interesting job posting on January 20. In this advertisement, first reported by the Bloomberg agency, it was stated that Neuralink was looking for a clinical trial director. The advertisement emphasized that the person in question would work with Neuralink's first clinical trial participants. The opening of such a job advertisement was interpreted as Neuralink studies carried out on monkeys and pigs so far will now include humans. The device developed by Neuralink, which was founded in 2017, is the size of a coin. The biggest advantage of this device compared to the brain-machine interfaces of the past is its very thin and flexible wires that can be directly connected to the brain tissue. Because it is known that the hard needles used by the old generation devices damage the brain cells. Musk is assertive that the devices can be used to solve many neurological problems, from memory loss to addiction. However, before the device can be used in the healthcare industry, approval from the U.S. Food and Drug Administration, FDA, is required. According to the job posting, the clinical trial coordinator's job will also be to manage this approval process and manage relationships with the FDA. First, a small feasibility study will be conducted to see how the device works. Since it is a risky device that has not been used in humans before, FDA approval will be required for larger trials. Musk's new target 2022. It is not yet clear whether the company has started recruiting volunteers for human experiments. However, in a statement he made in December 2021, Musk said that they aim to place the device they developed in people's brains by 2022. Although Musk has previously announced his goals in this regard as 2020, so 2022 should not be taken as a certainty. It is obvious that Neuralink continues its work at full speed, whether it reaches 2022 or not. However, this situation causes anxiety as well as excitement in the scientific community. The poor control of Neuralink and the potential effects of the device on experiment participants are areas of greatest concern. Of course, it is necessary to add to this that the possible consequences of the integration of technology and the human brain have not yet been fully understood. University of Wisconsin-Madison medical history and bioethics expert Dr. I don't think the big picture implications of the existence of this kind of technology have been adequately discussed in public, said Carola Kraitmeyer. I am concerned that there is an uncomfortable marriage between a profit-seeking company and these medical interventions that I hope can help people, Kraitmeyer told the Daily Beast. The news of Stat News, one of the most respected publications in the world in the field of health news, dated August 25, 2020, led to serious discussions about what happened behind the scenes at Neuralink. While everyone was waiting for the future after Musk's words, I am concerned that there is an uncomfortable marriage between a profit-seeking company and these medical interventions that I hope can help people. Some former Neuralink employees who spoke to Stat News made a lot of noise. In the news, it was told that Neuralink, which looks like a technology company that works very fast from the outside, is not much different from other scientific research companies, and the same slowness problems are valid here as well. Speaking to Stat News on condition of anonymity, the four employees had described the internal environment as chaotic since the company was founded in 2017. In the news, which stated that Musk expected to make a lot of progress in a very short time, it was stated that scientists had to manage these unreasonable expectations. Another important point underlined in the news was that 5 of the 8 scientists who were on the staff during the establishment phase of the company left Neuralink. The sources also stated that there were conflicts between the mechanical engineers working at Neuralink and the neuroscientist academicians about how the company should be managed, and stated that Musk was often on the side of the engineers in these conflicts, which angered the scientists. Neuralink's primary goal is to eliminate the various constraints created by physical disability. For example, with the Neuralink device to be implanted in the brain of a person who cannot use his arms due to a stroke, it is aimed that he will be able to use his computers and mobile devices with only his brain power. However, Musk's ambitions for the next stages are much bigger. In a statement he made in 2019, Musk explained that he wanted to ensure the symbiosis of humans with artificial intelligence and thus prevent humans from falling behind the machine. Experts, on the other hand, state that every stage of Neuralink's progress, especially clinical trials, is cause for concern. SUNY Upstate Medical University Center for Bioethics and Social Sciences faculty member Dr. "These are very niche products," said L. Sid Johnson. "These are very niche products." Johnson continued, "If the ultimate goal is to use the acquired brain data for other devices, or to use those devices for other jobs, like driving Teslas, then the market could grow very, very large. Then all the volunteers who participate in human trials, the people who really need it, are exploited and used in risky research for someone to make money. Installing the chip is okay, what about removing?" Of course, there are also scientists and academics who have expressed hope that Neuralink will mean a new treatment method for patients. But they all agree that there are some moral issues that Musk and his company need to resolve. Let's say that one of the clinical trial participants changed his mind and stopped participating in the study, or he developed some undesirable complications. What will happen in this case? Professor of neuroethics at Penn State University, Dr. "From what I've seen in the field, we're pretty good at implanting devices into people's bodies. But when something goes wrong, we don't have the technology to remove them safely, without any damage to the brain," said Laura Cabrera. On the other hand, doctors stating that there are concerns about how tightly the board that will oversee Neuralink's trials will hold the job. Conflicts of interest are common in corporate review boards, Kreitmeier said, adding, "I hope Neuralink's high-profile work will allow it to scrutinize what will happen to patients who have had a device implanted in their brains if Neuralink goes bankrupt." SUNY Upstate's Dr. Johnson, on the other hand, questioned whether the scientific competence of the startup founded by Musk will meet the expectations, and said if Neuralink claims that the developed device can be used for therapeutic purposes and can be used to help the disabled, it means that they are making promises that they cannot afford, because they are still far from being able to do it. Experts state that even if the trials are successful, the uneasiness they feel will not disappear, perhaps even double. This technology has the potential to change the lives of people who are paralyzed. However, if the implants are used for that purpose and are successful, there will be an appetite for this technology to be made available to the general consumer, Kreitmeier said. As an example, he listed many application areas from reading emails with only brain power to managing autonomous vehicles. This technology has the potential to change the lives of people who are paralyzed. However, if the implants are used for that purpose and are successful, there will be an appetite for this technology to be made available to the general consumer.